President Cyril Ramaphosa has extended South Africa's adjusted lockdown level 4 for a further 2 weeks, and all of this in an effort to try curb this third wave of COVID-19 infections. So in the last 2 weeks, new daily cases averaged at around 20,000, and active cases are now standing at more than 200,000, with more than 4,200 deaths in this period. Senior researcher at the Council for Scientific and Industrial Research, Dr. Ridhwaan Suliman, has been keeping a close eye on the COVID-19 infection rates. The doc joins us now via our video link, and it's great to have you on the program. Thanks very much indeed for making time. I wonder if we can start with a special focus on Gauteng. You've done a really great job at helping us, I guess, keep the faith by showing us how the curve appears to be turning now. Is that a sign that level 4 is working, at least in Gauteng?
Good morning, Ayanda. I think that we are seeing some promising signs, and we can probably see a glimmer of hope in Gauteng, where the number of reported infections has slowed down, and possibly having passed a peak in Gauteng over the past week. I don't think that it's all just a reflection of level 4 restrictions in Gauteng. It was always expected to peak around that time. I do think, though, the change in the trajectory and right now is probably then a reflection now of the level 4 restrictions in place in Gauteng. That being said, the infection rate is still incredibly high, still at 65 new cases per 100,000 per day, and so we can't let our guard down. We still really need to drive those numbers down, and then beyond just cases, hospitalizations and deaths do lag cases by about 2 weeks, so we'll still continue to see an increase there for at least another week to 2 still. So I think it's certainly not out of the woods just yet, but there is a glimmer of hope in Gauteng.
Given the latter part of what you've just said, did what the president then do the right thing?
Look, I think it's no surprise. I think it's no surprise that we're seeing an extension of the current level 4 restrictions, given that the infection rate remains high, still in Gauteng, but more so still increasing in all of the other provinces, particularly the neighboring provinces of Gauteng. Limpopo seeing a surge right now, but then the 3 big provinces, Western Cape, KwaZulu-Natal and Eastern Cape, about 2 to 3 weeks behind Gauteng's trajectory and still seeing a rise in infections. So really no surprise that we're seeing an extension of the current level 4 restrictions.
Yeah, I want to just hone in on the death toll we've seen in the 2 weeks gone by. 4,200 odd people losing their lives to COVID-19. The infection rate and its acceleration, we're told, is because of the Delta variant. It's a whole lot more infectious than many other mutants. But what do you read into this death toll, though? From my untrained mind, it's a bit high.
Unfortunately, following the surge in infections and what we're seeing being reported in the number of cases, unfortunately we're seeing that being reflected with an increased burden in hospitals, and sadly the true burden or the impact of this is seen by the rise in the number of deaths right now. Remember that hospitalizations and deaths do lag cases by about 2 to 3 weeks, and now we're seeing a surge in the number of reported deaths, particularly in Gauteng, following its really devastating surge in infections. Nationally, we're reporting an average of 375 new deaths per day over the past week, and that's increased by 52% compared to the previous week. Unfortunately, new deaths reported are doubling about 11 to 12 days. In Gauteng, the number of reported deaths accounts for about 45% of total deaths, and new deaths there have increased by 39% week on week, with an average of 152 deaths per day in the province of Gauteng. So unfortunately, we're seeing the devastating impact of the surge in infections now being reflected in the deaths, and unfortunately this still will rise, considering that we are still seeing an increase in hospitalizations.
Sure, yeah, and that really was my next question. How much longer will we see this taking place? Since you've answered it, let me perhaps pick your brains on what we're seeing take place in the UK. Hopefully you're watching that quite loosely. Interesting decision by the government there to essentially lift their restrictions, given how many people have been vaccinated. Their infection load is going up, but their deaths aren't increasing at as fast a rate. Clear signs that vaccines work?
Yeah, look, there is some indication and some research and data coming out showing that even though the infection numbers are rising in the UK, there's this split where there's lower hospitalization and death amongst the elderly. I think, though, that the concern is not just severe illness and death. With an increase in infections, there's always the possibility that the virus can mutate as it replicates, and we will continue to see more variants emerge through this COVID-19 virus mutation. And then beyond that, there's still many people who do get infected who suffer from long COVID. So yeah, while there's possibly some good indications that severe illness and death is reduced, I think there are other factors that also need to be borne in mind with the rise in the number of reported cases and infections that country is still seeing.
Yeah, and just on that, this phenomenon of mutations possibly building up, some articles also coming out over the weekend suggesting that the possibility of mutations taking place is much higher among individuals who are not vaccinated than it is from those who have received the jab. How much knowledge do we have of that, scientifically speaking?
To be honest, I'm not really sure. So I'm certainly not an expert in that field. Basically, from my understanding, unfortunately, is that the virus will mutate as it replicates, and so ultimately we do just need to reduce transmission and reduce opportunities for the virus to mutate. And the only way to do that is to limit the onward spread of the infection.
Yeah, it's a tough pill to swallow for many South Africans because the logical conclusion of what you're saying is non-pharmaceutical interventions are here to stay, even once we reach so-called herd immunity.
So unfortunately, Ayanda, we won't ever reach herd immunity. I think it's probably a misnomer that there's this magical target that we will reach and suddenly things will come back to normal. Herd immunity will never be reached. I think we do need to understand that we're going to have to live with this. And it's not scaremongering or fearmongering, it's just the reality. If you look at the reproduction number of the rate of spread of the virus combined with the efficacy of vaccines, we'll never reach a level where herd immunity or the so-called herd immunity will be reached. I think we do need to try and focus on limiting severe illness and death by vaccinating those most at high risk and the elderly, and then beyond that, just try to just limit the spread as much as possible, and try and find a way to live with that by still minimizing the damage.
Hold on. Many people will be taken by surprise by that. What do you mean we'll never reach herd immunity? Perhaps let's start by understanding what your understanding of that is. In my mind, it's a situation where enough people have antibodies to be able to successfully fight off dying from COVID-19, which is essentially what we're aiming for. That is what we'd always been told was possible if enough people were vaccinated.
So look, when we say we reach herd immunity, we have this in our mind that we'll reach a sufficient threshold of people to prevent the onward spread of transmission. I mean, if you just think mathematically, with for example, an R0 for the Delta variant put at around 6, which indicates that we'd need much more than 80 or 90% of the population vaccinated, if even. Beyond that, if you take into account the efficacy of vaccines to reduce transmission, it works out that you need to vaccinate more than 100% of the population in order to slow down the transmission, which is just theoretically impossible. Beyond that, we know that the different variants will emerge and will continue to emerge as the virus mutates and replicates. And so, particularly in a country like South Africa, how do you reach the entire population to slow down transmission within the time frame that allows for the current variants at play. So really, herd immunity, unfortunately, to stop transmission is not going to be possible. So the focus still, I mean, that there's still, of course, the benefit of reducing severe illness and death amongst those that are most at risk, and that needs to be the focus when it comes to the vaccination efforts.
Dr. Ridhwaan Suliman, thanks very much indeed for your time. A lot of food for thought even at this late stage of the pandemic. A lot of introspection perhaps we all need to do, even whilst hoping to get to this stage of herd immunity. Ridhwaan Suliman is a senior researcher at the CSIR. Apologies for what was sometimes our shaky connection to him, but I think the thrust of what he was saying